This may not be a major concern for the world's most populous nation, but 15% of all Chinese couples of childbearing age are having problems conceiving a child. In vitro fertilization, or IVF, is what couples need. More than 400 hospitals nationwide provide the service, but couples need to queue up for years before they can be helped. One Chinese healthcare provider, Chiming Checkup, decided to move in. Founder Han Xiaohong said the health examination provider began to transform years ago.
We have been seeking to upgrade our business, along with government's policy favors and healthcare market demand. In China, there used to be restrictions on allowing private hospitals offering test tube baby services, so we chose to expand overseas first and set up reproductive clinics in the United States. While our American business has picked up speed, we would keep developing its operations. We would also like to bring such services back to China.
Han said the success rate for IVF procedures in China is around 30%, while the number is around 60 to 70% in the U.S. Melissa Brisman has helped many Chinese clients to have babies in America. She said that Asian couples now account for about a quarter of her clientele.
It's definitely not just my practice. There are some of my colleagues that claim that 90% of their clientele are now from Asia. This is mainly because of the law of large numbers. China has 1 billion people. The United States only has 300 million. So even if a small percentage of Chinese clients come to the United States, you're going to have a very large number compared to the number that is in the United States.
The industry has a newcomer these days, Global Fertility and Genetics, which was co-founded by Chiming Checkup, launched a branch in Beijing over the weekend. Chief Executive Annie Liu said she aims to help couples prepare for test tube babies in China by establishing multiple infertility diagnosis centers in the country.
That would be more convenience for our international patient because usually if you go to USA for a whole cycle, it's going to take more than probably like 20 to 30 days. But with our IDC center, we can definitely have the patient come into the center to stop doing the texting or blood text, whatever the screening here, and then they can prepare and to come to New York.
The Chinese government has been loosening its controls for entering the healthcare market. The State Council approved a pilot zone for healthcare and tourism in Boao County in Hainan. Han said a hospital will be completed later this year.
Our doctors are all Americans. We will let Chinese people enjoy American service on Chinese land.
The majority of test tube baby operations in China will still be performed in public hospitals in the short run, while many Chinese couples will continue to go to America to nurture their offspring. But the opening gives an alternative for those yearning to have a baby. 明天 CGTN 北京